It is Monday, and I think it's always great to start the week off on a healthy foot to kind of set us up for success. So what better way to start the week off than with a wellness watch? And so much of our overall health is directly linked to our digestive health. So joining us is physician's assistant Scott Zeilstra with the Digestive Health Institute. Thank you so much for being here today.
Glad to be with you.
Absolutely. So we have a lot to talk about, but every month we talk about our health topics and issues that impact so many people. And today we're going to be talking about fatty liver disease, which I just learned impacts 25% of the population. That's incredible. That's a lot of people. So first off, to kind of touch on the basics, if you could break that down for us, what is fatty liver disease?
Sure. So the liver is a good-sized organ that sits in the right upper portion of the abdomen. Most people know that they have one, but may not understand what it does. But it acts as like a filter for the digestive system, screening out different toxins and nutrients that pass through from the intestines. And fatty liver is when there is fat deposits that accumulate within the liver. And I like to describe it to patients like a New York strip steak as opposed to a ribeye steak.
Okay.
If you go to the butcher at some point and you look at the difference, you'll clearly see a difference in the fat content between those types of meat. So that's a visual that I think helps get the point across.
Yeah, and why is that bad? Why wouldn't you want to? I mean, it sounds bad, but why wouldn't you want to have this?
So there's a spectrum of disease severity. Thankfully, the bulk of people who have this condition don't progress over time, doesn't cause serious damage to the liver over time, but there's a sliver of patients who do have associated inflammation, and scar tissue can develop, leading to cirrhosis and even liver failure over a long period of time.
Okay, so what are some of the symptoms people can have with this?
Most people will not have any symptoms.
Okay.
Similar to like if you had high blood pressure or high cholesterol. These are not something that are usually driving symptoms.
Yeah, so like you said, a lot of those symptoms you might not have them, or they could be very similar to like other health issues. So what does diagnosis and treatment look like? How do we get from I have an uncomfortable feeling to a diagnosis?
Yeah. Many people that come to us, they've had routine labs done through their primary care physician, and it may be that their liver chemistry tests are a little bit elevated. And so they might come to see us, and we might run some other tests to exclude other causes of liver disease. We might ask for an ultrasound to be done, which looks at the texture and the size of the liver, which we might see kind of a heterogeneous brightness of the liver. And then we would do further tests to see how much scar tissue has accumulated over a length of time. And in rare cases, a liver biopsy might be performed just to really nail down the diagnosis and see how far it's gone.
Okay, so definitely if you think you might have something wrong, definitely get a diagnosis so that you can figure out and then move forward. So, besides a few of those risk factors, there are a lot of them that are actually things slightly in our control, or at least that we can try our best to be proactive about, like eating healthy. So how can we mitigate those risks?
Yes, so the main risk factors for fatty liver disease being obesity, high cholesterol, diabetes, high blood pressure. Essentially, the treatments that address those problems will often be helpful for fatty liver disease. The common underlying theme to that being weight loss.
Weight loss. Okay, so overall, that's kind of like the umbrella that should keep you where you want to be. So, where can people find more information, or maybe even information on where to talk to somebody about this?
Well, being such a common condition, you can use the old web, and you'll find plenty of sources that will give you tips on what might be some lifestyle changes that would be helpful. I'll just lay out a few of them that I think are intuitive, but increasing physical activity. Most people who have diabetes or overweight have heard that message before, but increasing physical activity, lowering the calories per day of consumption, and then there's a couple of medicines that can be used. Vitamin E can be used for patients without diabetes, and then there are some medicines specific to diabetes that are known to have more of an association with losing weight.
Okay. All right, so overall, just taking care, being proactive about your health. If you are overweight, trying to make healthy choices as much as possible. Well, you know, I always learn so much from you guys when you're on our show, and it's great that we're doing it on a Monday because it kind of, you know, gets the week started right. But thank you so much for being on the show. Of course, where can people find you?
Yes, so our company, Digestive Health Institute, as part of the Pinnacle GI Partners, we're located in East Lansing, just around the corner.
All right.
So we're glad to see you for any digestive concerns.
All right, well, thank you so much for coming. It was a pleasure talking to you.
Glad to be here.